It's very good information, and information we needed to hear for sure. As I said before, these next decisions are some pretty crucial decisions for all of us, so we do need to understand everything that's coming at everybody. What does a mandated employer look like? What are the things that they need to be considering? What's some of the critical thinking that they need to go through? The same concerns that I've already addressed earlier this morning are the same concerns for large employers. It's all about the attraction and the retention of our best and brightest. It's all about how productive our workplaces are. It's about how healthy our people are. Those are the things that matter most. But I do have to stop right here, and I'd be remiss if I didn't, and at least acknowledge the fact that there are employers here in the UP, all over the country, that are going to be newly mandated that have never dealt with this before. They've never offered health insurance. This is a whole new world for those folks. It's a line item that doesn't exist right now in the expense column. We have to acknowledge that. The same critical thinking measures have got to take place for all of you. It's the same thought process. What's different, unfortunately for you guys, is that the mountain might be a little bit steeper climb because you may not have some of that expertise already there within your organizations to sort of muddy through some of this stuff. So make sure you understand, you got to still do all this analysis. You have to make sure that you get through all of this stuff and understand it. When it's all said and done, I really firmly believe that the employers that come through this 5, 10 years from now, whatever that time horizon looks like, as strong employers or of the ability to survive and thrive are going to be those that understand that this isn't the time for knee-jerk reacting and to really understand the decisions that you're making. A short-term cost-saving consideration or a decision made right now in this year for 2014 may end up being a decision you wish you hadn't made down the road. If it flies in the face of your culture, the corporate culture you've worked hard to build over the years, who you guys are, if it flies in the face of that for a short-term cost savings, that might not have been a great decision. There is no crystal ball. None of us have them. If I did, I think I'd be a rich woman. I don't. What do we have to rely on? The best possible strategy that I can give you is one that I know you're using every day in all areas of your life, and that's focusing on what we can control. Why spend an abundance of time fretting over things that are not in our control? Should we know what they are? You better. We have to know what they are so that we can manage them to a positive outcome. We have to. But there are only certain things that we can control. So what are the big things that we need to be thinking about? I want to make sure, let me give you an idea of what I'm talking about when I say managing things and not being able to control. We heard a lot this morning about employers that are going to need to be managing things like stability and measurement periods and things like that. Let's assume I'm a contractor, okay? Because we use that example. Let's just go with the contractor. I'm a contractor, and my entire survival, my entire existence is dependent on being able to successfully bid work. To do that, I may need to dedicate labor to deliver that contract on time, that job on time. I may have to manage my labor differently than I did before. I may have to hire some people. They may be working longer than a seasonal worker would. They may be working more hours. People that were already there that were not eligible, maybe now they're eligible for benefits. I got a lot to manage here. What's my alternative? Don't bid the work? Is that going to be a sustainable model for me? Is that the right model for me? It might be. But if I decide not to bid that work from here on out, who's bidding it? What did I just do to myself? So we've got a lot to think about here. If we focus only on staying small, business owners, business leaders, managers of organizations, if we focus only on staying small, then we die on the vine. We have to be thinking about those things that we can control. So what are they? Minimum value, we heard at length what that looks like. Make sure my plan's compliant, make sure it's meeting minimum value. Once we've established what that looks like, what am I charging for it? Is it affordable to my people? What measure am I going to use that Joanna was talking about earlier, safe harbor? Which one do I choose to use? Let's assume I choose to use, I'm going to take my lowest paid employee, I'm going to take the W-2, I'm going to take 9.5%, I'm going to take my lowest cost plan, I'm going to do the math on that. Boom, I've got my contribution, I'm affordable. Those two things I can absolutely control. Eligibility. We heard about what's going to make folks eligible. We can control and manage that. Is it going to be easy? No. It's kind of like intermittent FMLA, probably times 10. It's going to be tough to do that, but we can control and manage that. Now, word of caution, we were talking a little bit off on the break about managing those hours and what makes folks eligible, and the 2013 look back year, and that's where we're going to determine we're either mandated, we're also going to determine who's eligible from that 2013 year. You can do what you want to do this year. It's not going to impact you. You can't get, what I'm trying to say is, you're not going to get penalized for it. But just know that as you're going through this thought process and you're making these decisions for what it's going to look like in 2014, if you're going to start managing people differently, there is language in the newly proposed regs that Joanna's been talking about in the preamble that they've put in there on anti-abuse rules. The federal government's paying attention. They're paying attention to everything we're talking about. They're paying attention to the high-profile people on Fox telling us what they're going to do to circumvent the act. It's going to get addressed. So make sure that you're keeping in mind that it may not be quite as easy as you think to circumvent this and have a zero penalty year after year after year and not insure anybody. It's going to be tough. So make sure you're paying attention to all of that kind of stuff. Communication. You can absolutely control the communication that's happening in your organization. If you don't have a well thought out communication strategy already in your organization, forget about PPACA, you're behind the 8 ball. But let's assume you do. Communicate and over-communicate, collaborate, make sure that your people understand the decisions you're making, the thought process behind them, how it's going to impact them, what their options are going to be. They need to fully understand all of this so that they can embrace the decision. That's probably the most important part of this. How can I embrace something when I don't know why you did it? Especially if I view it as an impact that's negative to me. Well, if I understand everything behind it, and I know that's tough to do, you can't get way in the weeds where she took us, but they can at least understand why it's the best for the organization to keep the doors open, to keep us all employed. Make sure that you're communicating that. You can absolutely control it. Some other considerations that you may want to be thinking about, we already talked about contribution strategies. You may want to rethink some of those, make sure that those are going to work for you. The Medicaid expansion I talked about earlier. If you're a large employer, this is really meaningful to you. Pay attention. If some of your people are some of the 500,000 newly eligibles in Michigan that are going to go into Medicaid, you're going to have some folks come off your plan. Obviously, that's a dollar-for-dollar direct cost. If you're a fully insured, if you're self-funded, or an over 50 group, you're experience rated for sure. So the claims from that population are still a component of your premium off the exchange, and nobody's going into the exchange in 2014 if you're a large employer. So make sure that you're paying attention and doing some analysis on that. And though it may not be a popular thing to say, it's true. There's a clear link established between income and health status. And so the experts are predicting that the larger employers will benefit from the Medicaid expansion because some of the unhealthy lives are going to move out. How healthy is your workforce? This is a consideration. What have you been doing up until now to be able to inspire good health or promote good health? Some of you probably already have some pretty well-established wellness plans in place, and you may be using the provision already in HIPAA, the 20% allowable in the differential in premium to be able to incent healthy behavior for your employees. Great, I'm glad. If you didn't know it, most of you, if you've got a plan like that, you know it's going to 30% January 1st, so you've got more tools in the tool bag than you did before. If you haven't dipped the toe in yet, consider it. There are a few gifts in PPACA, very few. There's a few gifts there, though, so know where they are and know how to use them to affect productivity, because again, I'm going to come back to productivity. It all boils down to that for every single one of us, whether you are a for-profit manufacturer or a nonprofit organization delivering service to clients. We're trying to inspire our people to be as productive and as efficient as possible. This is a big part of the equation. So make sure that you understand all of these components, what's in there for you, and what you may be able to take advantage of. When I hear business leaders, like I was talking about before, standing in front of us and talking about what they're going to be doing to remain small, it blows my mind. I guess I just never imagined we'd be living in a world like this where we're all trying to figure out how not to grow. It's just not, it's not right. It's wrong. We have to continue to manage for growth. It's the unknown. It's what I talked about before. There's no history. We don't know where we're headed. So as a society, we're pretty afraid of it. And this fear, I think, is what's causing a lot of uncertainty and misunderstanding. We got to get behind this thing. The one thing I did talk about in the beginning that I have to expand on a little bit, because I feel like I need to at least say what hasn't been said. We've said it in 100 different ways, but the formulas may be a little sketchy. Right from the beginning, we all heard that the numbers probably weren't right, and then the CBO came out after and said, "Yeah, they weren't. They are higher." Well, one of the, I believe, what's going to end up being one of the bigger flaws in the formula is the affordability test itself, and the fact that Joanna has told us now probably 50 times it's based on self-only coverage, individual-only coverage. So if I'm an employer, playing devil's advocate here, if I'm an employer who decides that I'm going to continue to offer coverage, I'm playing, and I'm going to make sure that that coverage is affordable by making sure that my employee-only contribution is extremely low, and I'm going to offer coverage to dependents, the dependents that I have to offer it to, but I'm going to do that at 100% my employee's cost. What did I just do? I'm compliant. It doesn't matter what they do. I'm not going to get penalized. What are their options going to be? What does that look like on the other side? If they had to go into the exchange or they went into the exchange, as Joanna talked about before, will they be subsidized or not? They were offered affordable coverage, right? We don't know exactly what that's going to look like, but the fact remains it wasn't affordable to this family. So now we've got people in the exchange and claims being paid, yet over here on this other side, where they were hoping that the federal government, I got to believe, was thinking there was going to be some sort of a penalty paid into that pot of money. That's not going to go in. May or may not come to fruition, but I believe that there's a lot of these little things weaved in here that are going to undermine the sustainability of the act. That spells change down the road in terms of the numbers we're all talking about, penalties and otherwise, and that's the way that the legislation is written. They can increase without our permission as needed. So just know these things, that they very well could change. And I guess what I want to say here, what's most important for you to understand is, even though I'm gloom and doom and fear, I do believe that this can be navigated. I do believe that you can come through this in a positive way and that you can still continue to grow. It's possible to do, as long as you know what's in front of you. So my best advice that I can give to you as a benefits and risk advisor is to be cautious and take it slow, obviously, and understand what's in front of you, stay level-headed. Analyze the upside and the downside of every decision you're going to make. There may be a few upsides in there, so make sure that you're finding them and exploiting them as much as you can. Use what you know to be sound data and sound rationale before you make that decision. Don't forget who you are. Don't forget who you serve, what your mission is. Don't abandon your corporate culture. Use those things as your guiding light through this to make your decisions. It's who you are. Seek the assistance of those uniquely qualified to be able to assist you to navigate the legislation. Surround yourself with a team that knows the act, that knows how to help you get there. Most importantly, probably, that knows you and knows your organization and what the values are. It's the best advice I can give you. So what I need to do now is bring Joanne, we have to back up in the slides, and George is going to go through and finish up thoughts on the large employer mandate.
So here's the great thing, though. With Blue Cross, what we have done is really to try and put together a package to help the large group market navigate through all of these taxes, reforms, subsidies, and so on and so forth that are going to hit them, and to really try and help them create a benefit package that will work for them. We've done this in two major ways, the first of which is called Healthcare Path Forward, and I'm going to demo that here in just a moment. But what that really is it truly looks at our group business that we have currently insured. And last year, actually in 2012, we launched to our 100-plus groups where a face-to-face visit with every group to go over where they fall in line with the penalties, their association with their members. We looked at the rules about household income. We could discuss the safe harbor with them face-to-face. This year, 2013, we are going to move that down to the 50-plus level. So if you have Blue Cross and Blue Shield as a group insurance, at some point over the year, you will have an opportunity to meet with us face-to-face regarding your specific plan. And again, I'm going to show you that here real quick.
All the way to the right, the red one.
I didn't know your mouse didn't work. I got it.
You got it?
Yeah, I got it. So this is briefly what it looks like. Now, again, this package would be custom. What we're going to see today is kind of a scenario of multiple different packages. But essentially what Blue Cross has put together on the path forward is truly a series of analytical tools that will be rolled out to the groups. The first, which again was the one we started rolling out last year and the one that we're looking at right now, is referred to as the Reform Action Guide. And the key piece of this, again, is that it is very specific to the group that in question. When we go out, it is not this high level, this may or may not be. We bring in a lot of factors, including your group membership, some household income information. Again, we can talk about using a different form of the safe harbor to try and calculate that. But the key is really to make sure that we are looking at your group and what needs to be done for you. The other thing that's really great about it is a lot of the mathematical calculations that Joanna talked about, we've already done for you. You don't have to sit and figure out what your penalty is going to be. You would not necessarily have to calculate the fact that it's one versus the other. So the presentation really, again, starts to look at the different programs. As we move forward and we start bringing in other pieces of the legislation, we'll develop more of the programs. This slide of the presentation really talks about the fact, again, that it is specific to the organization that we're going out, and it is due to the fact of the law. So the key parts that I was saying when I say that it is specific to the group, we really look to see what that employer-sponsored insurance program is with Blue Cross and Blue Shield at the time. We take that current lowest year premium equivalent rate. Again, you don't have to figure that out. We've already built that in for you because we know what your plan is, so we know what your rate is. So we bring that in so that we know how to rate your plan against the income levels. We also built in a trend projection at the time. Obviously, when we started to roll this out, we were a few years out, to bring the plans up to the rate as of 2014. So that way we were sure that when we're going out sitting face to face, we're not giving you a number that is not going to be realistic when we actually open the exchange or when the rules regarding the penalties went into effect. And last but not least, again, there's a lot of discussion around household income. Who's counted in that? How is it counted? How is it going to work? Will employers know what household income is? The safe harbor laws that have been, or rules that have been brought in to help assist with that. Blue Cross used the standard calculation of the 9.5% of the household income. We actually used a third-party marketing and research firm that went out and extracted household income data based upon public records. So we tried to bring that in to make sure that it was realistic as possible. And we also offer the groups the ability to use one of the safe harbor rules. For example, if they said that we aren't comfortable with this third-party research data, we want to use W-2 income. Okay, we can look at that, or we can help you navigate through that to understand what that means to use one of the other rules. We also look at the affordability and minimum essential coverage pieces. Again, Blue Cross is ensuring that all of our plans, individual or group, will meet the minimum essential coverage guidelines. So we're basically taking that concern for the group off the table. You don't need to calculate whether or not your plan that you are offering will meet those requirements. We'll do that for you. The piece that we really need to look at with you as a group is your plan affordable? We've talked all day about how you build affordability guidelines at the 9.5%. Again, talking about household income, the safe harbor rules, different things. For sake of time, I'm going to actually get to some of these slides that have a lot of meaning that you'll see. Now, the nice thing, too, moving into 2013, is when we started rolling this out last year, the Supreme Court had not made a decision. The elections had not been finalized. So there was a lot of ifs still in the air. With what we know today, with a lot of the clarifications that were issued at the end of last year, we are actually redesigning the whole package to make sure that the information that we deliver going forward includes all of that data. So even if you were a 100-plus group that got this last year, you will have the opportunity to get a revised version that will show you what those changes have been. This slide, which is included in the presentation, is really just meant to be an easy to determine, am I subject to penalties or not? You just read down as a flow chart. Do I have employees who have household income at less than 400%? If the answer is yes, you move to the next level. If the answer is no, then you just have no penalties. And you just keep working your way down. And it drills, like I said, all the way down through the subsidy. It's easy to write it in words, but sometimes it's easier to really see it, visually to see if this, then that. And it really drills it down. It's a great slide. I've had a lot of people throughout our organization ask me for copies of it to use in their own information. So basically what we just came up with when we ran all these profiles of the individual groups is everyone fell into basically one of these four categories. Either what you offered today met the affordability, we're guaranteeing the minimum essential, and therefore you're status quo. You have nothing that you have to worry about as you move forward. You can keep the plan design you have, you can keep the premium share that you have, and life moves on. Depending on where you fall in profile A, B, or C, there are decisions that would need to be made. Generally, those decisions are either one, do we change your plan design to something that can bring down your premium and therefore bring down what you pass on to the employee as a premium share? Two, as a company, do you decide that you're going to adjust your premium share to make it affordable? And three, in some instances, do you adjust your wages? Do you pay your employees more to make it affordable for them to fall under the 9.5%? Or do you just decide to pay the penalties? In some cases, honestly, the penalties may be less than the overall result of making a change. So here's really kind of the glory of the report because of the fact that this is where we bring in all of the group-specific data. And really, when we look at this, and here it says generic package, but this would be the name of the group that we're visiting that day. It would show underneath their name the number of employees that we have in our data based upon, again, we know how many people you have enrolled in our plan. They're enrolled with us. And then after that, you'll see that there's a number that says used in analysis. Again, because we use a third-party marketing research firm to go out and collect household data, if we can't reliably gather data about that individual employee, we can't include them. That's not fair to you as an employer. So we actually extract them out of the group. So in this example, it's just basically saying that there was 1,000 employees. Of those 1,000, we were only able to verify household income on 900 of them. So those were what was used in the analysis. Now, again, because of the key really is the fact that it's the under 400% that would be eligible for a subsidy on the exchange. If you had someone and didn't fall in this category, they were making over 400% and they went to the exchange, they wouldn't be eligible for a subsidy anyway, therefore you wouldn't be paying a penalty. So this profile 0 is really the one that we talked about. They don't have to do anything. What they have today is in line with premium, it is in line with benefit, it is in line with everything that they need to ensure moving forward there is no penalty. Now, the interesting thing that you'll note, and we did include this in our package because it does appear that the state will, in fact, move to 138% of household income for Medicaid. Again, if for some reason that changes, all of a sudden we would certainly update the report. But the assumption is that the state will do that. So if you look at the little orange box, basically what this really lets employers know is this is your risk. You have 128 employers based upon what we show as household income that would be eligible for Medicaid and leave your program. That may or may not have an impact. If you're at a group that is essentially at 70 employees, and if you have 30 of them that are now going to be eligible for Medicaid and they leave, now you become a small group because you fell under that. You don't have that membership. So that's really what that tool is used for. Then we do break it out for the same group. Again, this is all hypothetical, but based upon this, we show if they do nothing, they have no additional premium contribution required, and there would not actually be a reform subsidy against them. However, if this group chose to end coverage altogether for their employees, based upon the penalties required, they would be subject to $3.2 million per year in penalties for opting out. Now, if you do the simple math, and Joanna alluded to this earlier, it does not compute. Blue Cross builds in a 40% shift in actual tax. If you look today, your taxes or your benefits as an employer are a pre-tax benefit. Penalties are a post-tax penalty. So essentially, we're building in a 40% tax shift to say you were getting this benefit pre-tax, you're now paying a post-tax penalty. So in addition to the penalty, you have to recognize there's an additional cost to your company that equates to roughly 40% tax. So we build that into our number because, again, we want the groups to really understand that it's not necessarily just $2,000 times 100 people. There is more involved to that. Profile A, and again, I'm not going to go through all of them in great detail. This one just shows that in this particular group, they would be subject to $5 million in penalties. However, if the group kicked in an extra $2.5 million in their own employee contribution or in their employer contribution, they could avoid those penalties. So the group would decide: do I want to pay $5 million in penalties, or do I want to pay $2.5 million more into my package to ensure that it is affordable? Again, that would be the group's decision. That same group could essentially choose to pay $3.2 million and get out altogether. And again, we have these discussions face-to-face with those groups while we're sitting there. Profile B, almost a 50-50 split. Either you pay the penalty or you bring up the contribution. You're at about the same rate. Again, same result if you decide to opt out, $3.2 million. Profile C, this one, again, brings in the fact that in this case, the subsidies switch, so your penalty actually would be $2.5 million versus the actual premium contribution of $5 million. Most likely a group in this situation would choose to pay the $2.5 million and not adjust their premium share to their employees. Again, because it's all the same group, $3.2 million for the exit. In the guide that the presentation, we do include, because a lot of people are not familiar with the actual federal poverty level and how to multiply that out, we actually do a family size up to 8 and multiply that out to the 400% so that people have an idea when they're going and looking at their payroll what those amounts are that would still let someone qualify. So that was very brief due to time as far as what those are. Again, we will be rolling those out. So as we move forward, we'll have a lot of information that we'll be able to pass along. There are some that, again, that we have already rolled out on the 100+ side, and certainly we can talk about that further. So let me switch. Okay, the other piece that I want to touch on real briefly, because I know we're short on time, is GlidePath. GlidePath is Blue Cross's private exchange. I talked about public exchanges earlier. GlidePath is essentially a private exchange that we've put through together as a company that groups who want to still offer some type of benefit but need to do it in an exchange environment rather than a funded environment would be able to work with our GlidePath specialists to set that up. It is also a very helpful arena when we are looking at those who are on retiree segments, because it's much easier to cover retiree segments on a funded plan or a cafeteria-style private exchange than it is on an actual funded plan. So last, for me, and we'll touch base really quick, is we fully recognize as a company that after careful consideration, there are groups, small or large, that may decide that they can no longer offer healthcare coverage. That either the risk is too great or the cost is too high. So we are really putting together a way to help all of the employees transition from a group business to an individual product within Blue Cross and Blue Shield. Most group employers who find themselves in that position still really have care and concern for their employees that somehow they'd be insured. And of course, Blue Cross wants to make sure that we keep them insured with us. That's our goal as a company. It has always been our goal for the state of Michigan as the insurer of last resort to insure the people of Michigan. So we will have several transitions set up to make it very seamless for an individual or a member that is on group to transfer over. There's a lot of scenario-based decision-making. Again, Pam brought up a lot of good things to talk about, and this is where we really advise you as a company, talk to your tax advisor, talk to your consultant, get with your agent. They know what options are available. They are on the upfront line of knowing what's going on in the environment, and they can really help you through it. And timing is critical. Like Pam said, there are downstream impacts. We have to really realize what we do today will have impacts down the road. Good or bad, we still have to recognize what those are going to be. Further communication, again, on Path Forward and other things will come soon. I have several meetings going on surrounding that, so we do hope to have formal rollout on that shortly. You're going to touch base on the, okay. I'm going to turn it over to Joanna. Again, as I said, some are going to transfer to that individual, and Joanna's going to talk about the individual mandate that will really kind of require them to take that coverage if, in fact, the group eliminates it.
Okay, the last few slides are regarding the individual mandate, and this mandate requires individuals to have health insurance starting in 2014 or pay a penalty. As part of the packet that you had when you came in today, our firm has a flow chart that will walk you through, if you are an individual, under what circumstances you may have to pay a penalty, and what the value or the cost of that penalty would be. So I would invite you to take a look at this if you have any questions about the individual mandate. For those of you who are employers or are employees of an employer getting your coverage as an employee, the individual mandate wouldn't apply to you because you have coverage. But if you're currently uninsured, this is something that you would want to be aware of because there will be penalties that you would have to pay. There are, of course, exceptions. Every federal law has a lot of exceptions, but the general rule is that we would be paying a penalty if we don't have coverage. But we wanted to leave plenty of time for questions, so if anybody has a question, I know it's been a long 2.5, 3 hours. We have a microphone here, and somebody from the partnership will be walking around with a microphone. And the reason we want people to speak into the microphone if they have a question is because this is being recorded, and it's very hard for the audio to transfer if there's not a microphone being used.
I always have a lot of questions. So I work for the Marquette Schools, and we have 4 unions, and we're a public school, so all of our employees have to pay 20% of the premium. That's going to add up to a lot more than that 9.5% of household income in many cases. What do we do about that? That takes us right out of the affordability category.
Well, it actually depends on how expensive your premiums are. And yes, if an employee is required to contribute 20% to premium, there's a good chance that that would exceed, that 20% contribution to premium would exceed 9.5% of the employee's household income. It's not automatic,
right?
Because we're throwing around a lot of percentages here, but it's possible that it could happen. And so when I've talked to other employers, subject to the same state law that you're talking about, they're talking about whether or not to move to the hard cap provision instead of the 80-20. And that may not be something that your organization has even discussed, but there are other options that you could use instead of requiring employees to contribute 20%. So that's, if the math doesn't work and you can see that that 20% required contribution as a public employer is going to make your coverage not affordable, then you may want to consider doing something other than the 20% contribution. And if you have questions about the hard cap, it's been a while since I've looked at that, but as a public employer, you can either require your employees to contribute 20% to the premium cost, or you can establish, I guess, what you would call a ceiling on what the total premium could be in the first place. And so that's what the hard cap is.
I had a couple others. What if they lie? What if they say they don't have an affordable plan, but legally they do?
I think that there is going to be that notice coming to the employer from the exchange, and that will be an opportunity for the employer to verify or to dispute whether or not that person has lied and actually has affordable coverage available. So there will be a check and balance in there. So if somebody lies, it will catch up with them. But there has been nothing written that I've seen about what consequences would come to the employee for lying. Mm-hmm. Usually when you lie to a federal or state agency, there's big trouble involved. But I haven't seen whether or not there would be any kind of penalty for lying. I don't know.
And the other confusing part was the measurement period.
Mm-hmm.
If you have to wait a whole year to measure it, don't you have to retroactively offer insurance, or does it start later?
You actually wouldn't retroactively be offering insurance. Your first measurement period, if you wanted to use a 12-month measurement period, could be the entire year of 2013. Mm-hmm. So you could start counting your hours right now and see who at the end of 2013 is full-time or not. And then their coverage, if they're full-time, would start 1/1/14 and go for the length of the stability period, which, let's say it's the same length as the measurement period. So the stability period is also 12 months. Now, even though we're calling that a stability period, it's also going to be your next measurement period, because you're also then, at the end of 2014, you're going to have to look back and see, okay, who during 2014 actually averaged full-time hours? Because that will then dictate whether they're treated as full-time during 2015. So they're overlapping. Your measurement and stability periods will overlap, except for the very first one.
And one final quick question. I assume that because this is federal, it overrides all of what our union contracts dictate as far as what type of insurance we have to provide. And
Yeah, usually when a new benefits law is written, it has exceptions in there for collective bargaining agreements, and there aren't any in this mandate. So it's possible that before we get to the start of 2014, that they would issue some sort of exemption for collectively bargained agreements that maybe were in place since 2012 or something. They always like to look back as far as they can. But I haven't seen anything in there right now that would say that you can stick with what's in your CBA.
okay.
That was a very nice presentation. I own 5 restaurants located through 4 in Michigan and 1 in Wisconsin. And our employee size, we probably would have, I guess, under the categorization, we'd have 8 full-time employees and probably 20 to 30, depending on the time of year, part-time employees. Mm-hmm. And I understand the math on how one calculates how they would fit into the categories. My question is that would it make sense for us to look at breaking up our companies into 5 separate companies and not have to be able to deal with that? I would imagine when you do the math that many of our wait staff and a lot of these part-time back of the house people would fit under that federal poverty level. Mm-hmm. And at this point, we don't offer any type of insurance for anybody. So as you said, that's trying to navigate through this. And I understand what Pam is saying. You always want to think big, but at the end of the day, there's just nothing there that we could help the employee with.
Mm-hmm. So you own 5 restaurants, and you're wondering whether or not you would be a large employer subject to the mandate, and you're thinking, if the numbers show that you would be a large employer, meaning you have 50 or more full-time employees and you would be subject to the mandate, would it make sense to break up the company maybe into 5 small companies? If the ownership of all 5 smaller companies is the same, meaning you own all 5, or you and your wife own all 5, or you and your 5 children own all 5, you would still be treated as one employer. I think those are called controlled group rules or common group rules. But the IRS has used those rules for a lot of benefits purposes in the past, and they apply here too. So if you sold your companies to unrelated persons and you kept one, that would be different. But if you break them up into 5 and they have shared ownership or identical ownership, they would be treated as one employer under the law. And if you, for example, let's say you have 4 children, you own one, child A owns one, child B owns one, C owns one, D owns one, they would still be considered one company because you're all related. So they're really trying to get you wherever they can. Now, you may find when you actually do the math that you wouldn't be a large employer. So, or that if you go through a penalty calculation that it wouldn't be as negative as you think. So don't get too depressed.
I'm an insurance agent in the UP here, and I was wondering, what are the implications for self-funding, like the larger accounts? Do all these same rules and regulations apply to that?
Unless you want to jump in here, regardless of whether you have a self-funded account or a fully insured account, the mandate would apply to you the same way. In terms of some of the rating that George talked about, what your premiums are based on, I do think there's a distinction between whether you're a small employer with an insurance policy versus a large employer who's self-insured.
Yeah, there are some variations when we look at particularly moving forward to large group going on the exchange and the way that the insurance will be rated. All products on the exchange, again, have to be rated on those factors of tobacco use, age, so on and so forth, geographics. If the large group insurance is purchased off the exchange, those same rating factors are not used. It's only those that are on the exchange. So if you have insurance that's not on the exchange today and you did not move to the exchange, the rating wouldn't change. Now, there are certain parts of the law that are pushed out for self-funded groups to renewal periods and so on and so forth, but in the end, they will all impact at some point. They will come down. Now, the rating it will not, because as long as a large group stays off the exchange, rating will continue to be different.
My question is about part-time employees. We consider our employees part-time all year, but you have a 30-hour rule. At what point over 30 hours for X amount of months are they full-time, not considered in the part-time hours?
You would actually look at whether or not they average 30 hours or more per week for the entire year, depending
Okay.
if that's the measurement period you've chosen.
All right, and if at any point they fall below that 30 in the year, then they're not considered full-time. We count them in the part-time hours.
Well, it depends on what the annual average is. So you may have a situation where somebody that you consider part-time works 30 hours during week 1, 35 hours during week 2, 10 hours during week 3, 40 hours during week 4. If the average throughout your entire measurement period is 30 hours a week or more, then they would be considered full-time.
All right, thank you.
My question surrounds a nonprofit. We have less than 10 employees, so that we're not going to be penalized. We've been wanting to get our employees insurance and can't afford it. So if they go to the exchange, become qualified for insurance, is there any expenses to the employer, and or can the employer help subsidize some of those expenses to the employee?
There would be no expenses to the employer because, as you stated, you're a small employer, so you're not subject to the mandate, which means you're not subject to the penalties. If you would like to subsidize coverage, you certainly could. I think there are some rules on whether or not premiums paid to the exchange can be made through a cafeteria plan, and I think that answer is no. But if you wanted to subsidize the coverage, I don't see why you couldn't. You might want to be sure that it's done through a pre-tax basis somehow, and I expect that could be done.
And once the exchange does open, I mean, it might be of value for you to look to see what products are available on the exchange if you're going to look to subsidize that somehow. And still, you're at an ideal employee base for the tax credit, being that you're at less than 10 or 10 or under. So it may be, if you're already considering some type of subsidization of benefit, to take advantage of the tax credit and still use the exchange to purchase insurance because of the rating factors that will be used on the exchange. It may be, again, I haven't seen the rates yet, but it may be more affordable than you think once you start to build in the tax credit. And then that would be something that you could look at as an expanded benefit for your employees. But until those rates are out there, I mean, it's just something to consider if you're already looking to contribute something anyway.
Okay, I have a question. We have a 8-1 plan year renewal. So what does that all mean to me? I mean, do I have to redo, I have a cafeteria plan, my plan year documents? I mean, should I just start drafting them for a calendar year right now and do a shortened year next year? I mean, do we know what's going to happen with me?
Sort of. When the regulations came out in late December, the regulations are issued in what's called the Federal Register. And whenever an agency writes regulations, they include a commentary in the Federal Register that explains why they wrote the regulations the way they did. It also includes examples sometimes, so lawyers always read the commentary because it sometimes is more helpful than the regulation. And while the regulation itself does not address a non-calendar year plan, the commentary that the IRS wrote as they were writing the regulation shows that they are probably going to offer transition relief for plans like you. One thing that I can think of as an example is that I think if, starting with your plan year that starts in 2014, so 8/1/2014, as long as you offer affordable coverage of a minimum value starting 8/1/2014 to your full-timers and their dependents, you wouldn't be penalized on what happened prior to August of that year, assuming you were offering coverage. So that's one thing to consider, and there are also other transition provisions or relief provisions in that commentary that would protect a fiscal year plan, because the IRS recognizes that not everyone has a calendar year plan.
Okay, and then also, we offer cash in lieu of benefits to our employees if they're on their spouse's plan, and they have to provide coverage, with their spouse or whatever. And I'm trying to think that through. If they would want to purchase insurance through an exchange with that cash in lieu of benefits, is that something that somebody might want to do, or is that not going to be, should I address that somehow?
Well, I think it is still a good idea to offer cash in lieu and benefits. The idea behind the mandate is not so much, this is getting really tinny, I'm sorry. It's not so much that you actually cover someone, it's that you make the offer of coverage. So if you offer coverage to your full-timer and say, hey, if you decline coverage because you have it elsewhere, I'll give you $100 a month, you've still made that offer. So they can do whatever they want with the $100 a month. Now, if they take that $100 a month and go to the exchange to buy coverage, first of all, they've lied to you with respect to whether or not they have coverage available elsewhere. And also, because they were eligible for affordable coverage of a minimum value with you, they probably wouldn't be eligible for any subsidy on the exchange. They could still buy coverage on the exchange, but they would be paying full price.
I'm an insurance agent, and right now the individual market has better rates than the group market. And somebody I know, they have close to 50 employees, and so they might meet the threshold or not. And he got a group quote, and he didn't like what he saw, and he's wondering if he purchased individual policies for each employee, would it be compliant as providing coverage under the Affordable Care Act?
Do you know that?
It would not. It would not. And two things here to think about. One, you lose all the tax deduction because you cannot deduct that because it is not an employee-sponsored plan. Those are individual plans and they are not tax deductible to you as a group. Two, then because of that fact, the government does not consider that being group-sponsored affordable coverage. Basically, you're just giving your employees a raise to go out and purchase individual coverage is really how they're looking at it. And then those benefits actually become taxable to the employee because they are income. They are not a pre-tax benefit. So there are a lot of ramifications of trying to offset an individual plan and treat it as a group policy for both the employer and the employee. It is very unadvisable to try and do it that way. I mean, it's not to say, I mean, as a business you couldn't make that choice, but you just have to be aware that you're giving up tax benefits. The employee is giving up the pre-tax benefit of getting the insurance through the group, and they are not going to consider it as a group-sponsored insurance.
Thank you all very much for coming out today. We really appreciate it. A special thank you and a round of applause for our panel. The full presentation will be available on the Marquette.org website in the near future. If you have any questions at all, please don't hesitate to contact our office. Thank you so much and have a wonderful day.